Fibroids or myoma are tough balls of muscle that form in the uterus. People sometimes refer to myoma as tumors. But fibroids are not a form of cancer. They are simply abnormal growths in the muscle of the uterus. Myomas often cause no symptoms at all. When they do cause symptoms, they can cause heavy periods, pain, pressure or a feeling of fullness in the belly, the need to urinate often, constipation, and difficulty getting pregnant. There are several treatment options. Each option has its own pros and cons. The right treatment for you will depend on the symptoms you have, your age, because most myomas shrink or stop causing symptoms after menopause, whether you are done having children, whether your myomas cause so much bleeding that you have anemia, the size, number and location of your myomas. Here are the options. Medicine. The pills, patches, vaginal rings, injections, and implants used for birth control can all reduce how much you bleed during your period. Some types of intrauterine devices, or IUD, can also make your periods lighter. Besides birth control, there are also other medicines that can reduce heavy bleeding. Surgery to remove the myomas called myomectomy. Doctor removes the myomas but leaves the uterus in place. It is effective, but it is not always a permanent fix because myomas can come back. Myomectomy is often a good choice for people who might want to get pregnant in the future. Treatment to destroy the lining of the uterus called endometrial ablation. This procedure reduces bleeding from heavy periods, but it is not an option for everyone. It is also not appropriate for people who might want to get pregnant. Treatment to cut off the blood supply to the myomas called uterine artery embolization. After the procedure, the myoma no longer gets blood, so it shrinks. This procedure is not appropriate for people who might want to get pregnant. Surgery to remove the uterus called hysterectomy. How do I choose which option is right for me? You will need to consider how invasive each surgery is and whether you prefer surgery over taking medicines. If you might want to have children, medicines or myomectomy is often the best choice. How soon you are likely to go through menopause. Myoma-related symptoms often go away with menopause, so your age might affect your decision about treatment. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.